This is Dr. Corey Maas on Looking Your Best. I've had a lot of women in the past several weeks, even months, that have come in with hair loss as a complaint. And it's not a huge rise, but enough of a rise to make me think that we're looking at ourselves more frequently on Zoom calls and go-to-meeting calls and noticing hair loss. And what's interesting about hair loss is we've probably lost about half of our hairs before we start seeing the scalp through the hairs. The hundreds hairs per centimeter squared is where we start. So if you think about it, you're down to something like 40 or 50 hairs per centimeter squared before you start to really notice your hair loss. And of course, at that point, each handful of hairs, 3 to 4 or 5 even, can make it seem like there's a significant difference in the thinness of hair or how much scalp you actually see. This happens not just in men, so women and all humans lose hair as we get older. In men, it just happens to be more profound in those that have the genetic susceptibility to hair loss, and it happens in a little different pattern. Men typically get frontal recessions, they get a crown type of balding, and as those frontal recessions reach back, they can often join together with the crown balding, and then the vertex starts to thin quite significantly. And in women, it's a little different in that the entire vertex or top of the head will quite commonly and evenly lose hair, but just in much smaller increments. And the thinning, therefore, is something that women don't often notice until they catch themselves in certain lights. But it's important to remember that there are medical therapies for that I've described before, and there are surgical therapies, and women are just as good of candidates for doing hair restoration as men are. They respond just as well. There's just as good of donor hair, and we can do an excellent job by going in between existing hairs. Once there's a certain amount of hair loss, it's quite easy to protect the existing or nascent hair and move into getting grafts in between. So there's always hope. We have a number of good medications that work for hair loss, and I'd refer you to some of my other videos. Spironolactone is one for women in particular. There's topical solutions. I have my own topical solution I have compounded in a pharmacy that's just for my patients that we know works better than any of the commercially available products. And so for women's hair loss, I would just say don't give up hope. It's also very cyclical. Hair seems to be thinner at times and grow back and be thicker at times throughout our lives. And hair is always being lost or shed. Some estimate as many as 50 to 100 days as when it goes into the resting phase, while new hairs are coming in and going into the anagen phase of new growth. So my short story on women's hair loss is there are good solutions. It's nothing to panic about. Patchy hair loss called alopecia areata can be treated by a dermatologist or someone that does hair work with corticosteroid injections and other treatments. And hair loss that's really just thinning, female pattern balding, can be first treated with medical therapy, and if needed, there's very good surgical therapies or hair grafting, just like we do in men. They're just as good a candidate as men are. So if you have any questions on hair loss in general or women's hair loss, don't hesitate to write me at drmaas.com. You can always send pictures, and I'm happy to have a teleconference call with you or a phone conference call. Share them with everybody if you don't mind. It's an interesting topic, and there's not any way to really notice the top of your head. A good photo for me to see is with your head leaning over so I can see the top of your head, and then take a picture with your head leaning back and see the back of your head. Those are our standard photographs. This is Dr. Corey Maas on Looking Your Best.